Well, it's a pleasure to be here. Well, good afternoon. I'm so happy to be invited to speak in that, what was called 2025 Spring Epidemiology Seminar Series. And as was already said, I received my PhD in University of Nebraska-Lincoln because I was asked to also share my sort of journey. But I originally came from Ukraine. I had an established career in Ukraine at the level of associate professor and dean for admissions. So I left to study in the United States and rebuilt my career here, finally reaching the status of full professor and all the other professional designations that I'm now involved in. To give you some highlights, so you already see on that slide, yes, I have two books published in mixed methods research, which are currently used in teaching about mixed methods. I'm an associate editor of the Journal of Mixed Method Research, and I developed and direct the program. It's a graduate certificate in applications of mixed methods research, which we offer through the School of Health Professions. And I did not include a slide, that we always share about the program and how to apply. But if you are interested, just send me an email and I'll be happy to share this information. It's a good certificate to have if you want to use mixed methods in your research career. And definitely it will give you an advantage when you do your job interviews or apply for jobs, move around. So what have not yet been mentioned is that I also co-direct the Institutional Research Core on mixed methods, qualitative and community-based participatory research together with Dr. Nataliya from School of Medicine. So we started that core a year ago. And we serve researchers from all around campus as well as outside in their needs related to these methodologies. So let's see. As it was mentioned, I co-edit the Mixed Methods Research book series with Sage Publishing. I included the slides just so that you see what books are available to help you in case you are interested in specific aspects of applications of mixed methods. Again, these books are aimed to address these practical issues of designing and conducting mixed methods research. And you see we have already 8 volumes devoted to using mixed methods in health sciences research, using mixed methods to develop culturally relevant interventions, using mixed methods in doing literature reviews. This is a new approach, mixed methods research synthesis approach, which is becoming very popular. Also, we have very specific books on how to use mixed methods with secondary data. This is a new sort of developing trend in mixed methods where we no longer have to only use de novo or originally collected data, but also can reuse all that data that was accumulated both in quantitative and qualitative research and how to incorporate these in mixed methods. We have a very interesting book on using mixed methods with qualitative comparative analysis. Again, an approach which is now very popular in public health research. And you see, so I was given this. This book is actually aimed to help you to write a mixed methods proposal for a dissertation. And this one is, although it shows the same size, but it's a big size book. It's like a workbook where you can actually write in, tear out pages, and work on your research problem and design your own mixed method study as you move along. So just again, to bring you awareness about these resources. So in terms of today's presentation, these are the 4 talking points that I will focus my attention. Of course, you don't expect me to cover mixed methods research in depth, but I think giving you the essentials of mixed methods, as well as focus on integration and how mixed methods designs and how the integration occurs in these designs would be probably what I could do within the remaining time, and of course leave some time for questions. So to begin with, so you see this graphic, mixed methods research. We love visuals because mixed methods tends to be quite complex. So how do we understand mixed methods? So how can we visualize? So you see 3 elliptical spheres, right? So 2 are here on the sides, right? Quantitative and qualitative, meaning that these are just mono method studies, such as quantitative and qualitative, like survey or interview studies. In the middle is mixed methods, when you bring the 2 together, right? And the more integration happens, which is shown through these darker shades of gray, the more sort of mixed methods you have. So this is kind of what mixed methods is. Speaking about a definition of mixed methods, this is the one that we use in our practice and teaching about mixed methods, and this is a definition that was advanced in the first inaugural issue of the Journal of Mixed Methods Research, which is the primary outlet for publishing methodological and empirical studies that use mixed methods. So the founding editors define mixed methods research very broadly to be inclusive of different perspectives, and it's a research approach in which investigator collects, analyzes, and integrates the findings from both quantitative and qualitative data or approaches or methods in a single study or over the program of inquiry. And also, I like to highlight that in 2011, the Office of Behavioral and Social Sciences Research at the National Institutes of Health published this white paper, which they titled Best Practices for Mixed Methods Research in the Health Sciences. And I remember those times we were all very excited because it sort of legitimized the use of mixed methods research in federally funded work. So again, here in this document, as you read, mixed methods research is defined quite broadly as a methodology that employs rigorous quantitative and qualitative methods, provides multi-level perspectives on the issue, employs rigorous methods, and uses multiple methods that are intentionally integrated within a study. And the research is framed within philosophical and theoretical perspectives. Again, a very broad definition. So moving forward, so why we do mixed methods? We call it Purposes for Mixed Methods 101. Why? Because these are the 5 purposes that were advanced by the in 1989 by again very prominent mixed methods researchers when they evaluated evaluation studies that use both quantitative and qualitative, and pulled out those purposes. So of course the first one, the most obvious one, is triangulation, where evidence is pulled from different quantitative and qualitative sources to corroborate the results, right? To kind of find supporting evidence from different data sources and different methods used. Complementarity, again, a very popular purpose when you use results from one approach to elaborate on the results from another approach. For example, you have the results from the quantitative survey, right? And you use qualitative follow-up interviews to elaborate, to better understand what the quantitative or statistical numbers mean, okay? The development is when you use the results from one approach to inform the development of another. This is a very popular approach that have been used, for a long time in research when you develop an instrument, right? Based first on qualitative interviews of focus groups, and then you use, the findings from the thematic analysis to develop scales and items for the survey, right? Or it can also be used to identify the variables to be further tested quantitatively. Initiation, this is a little bit more complex, meaning that you use one method to, in your research, and then you add another method to help understand any controversial findings or contradictions or paradox that emerged. Sometimes you find an unexpected result from hypothesis testing, correct? Or with your in the interviews, you suddenly reveal that your participants talked about something that was not yet previously reported in the literature. So you may use another method, such as qualitative interviews to follow up and try to clarify why the quantitative results happen to be like that, or vice versa. You can do a survey and survey more people to see whether these results are that you found qualitatively actually, whether they are true or maybe that's just a very biased representation. And finally, expansion, when you can use different methods to study the same issue, depending on the group of participants that you are involved in. For example, and this happens all the time when we conduct mixed method studies, specifically health sciences or hospital settings. You cannot do focus groups with clinicians, right? Because it's, they just will not, it's just not feasible. So we will probably think about doing interviews with them. But it's easy to do a survey of the patients. And of course, there are more patients that we want to capture, and we cannot interview all patients or even put them in focus groups because it will be very costly. So you use different methods to kind of gain understanding of the same issue, and then, of course, integrate that. So these are, again, the 5 purposes in all the rationales that we see reported in the literature why mixed methods research was used, build on these 5 sort of overarching purposes for doing mixed methods. So in terms of value added, of course, there is much more that I can talk about, say here, but I just decided to highlight 3 things. So what mixed methods add is that in one study, you can address both confirmatory and exploratory questions to gain a better understanding of the issue that you are studying, okay? Then mixed methods, of course, makes stronger inferences or study conclusions because you are drawing not on just one piece of evidence, but from several, right? That come from different data sources. And finally, mixed methods provides an opportunity to create a greater assortment of divergent views. Because if you just do the survey, you only have quantitative results, right? They don't give you why. But if you also talk to people, you can reveal different perspectives, right? That can help explain, or add to the patterns that you found quantitatively. So moving forward, how do we design mixed method study, which is, the focus of today's lecture? So again, based on the mixed methods practices, there are actually just 3 basic design logics behind, designing mixed methods, conceptualizing, planning, designing mixed method studies. And these are concurrent and 2 sequential. And this is the figure from our book with Vicky Plano-Clark. You see the first one shows you the concurrent logic when you collect and analyze quantitative and qualitative data independently, right? So you may have the survey data or secondary data analysis or, some data that are valuable, already that you can use, so you can analyze it, and then you can conduct use qualitative approaches to do interviews or to do focus groups, And then you bring the results from the two data set analysis to create inferences, integrated inferences. So very straightforward, right? And then there are two sequential logics. In this one, sequential quantitative to qualitative, you start with the quantitative strand. So you can do a survey, quantitative survey, or do again some kind of quantitative analysis of existing data. And you have to complete this phase, okay, to move on to the next one. So you take the results from that analysis, quantitative analysis, and you design your qualitative follow-up strand. And then once that is done, you connect the two sets of results and create integrated inferences. And the alternative sequential logic is when you begin with the qualitative, again, when you need to develop an instrument or to understand better a phenomenon. So you conduct focus groups or qualitative or do secondary analysis of the already existing qualitative data. And then once you have the results, you use those qualitative results to inform either the development of the survey and then administration of it, or maybe identifying a typology of variables to be further tested quantitatively and locate the instrument that would be relevant for testing those variables. And then again, the inferences are drawn based on the results from the two data sets. So I will illustrate all these on specific on published studies. And so based on these design logics, we distinguish three core mixed methods designs: concurrent. There are actually several terms that are used in the literature: concurrent or convergent or parallel convergent, and it used to be triangulation, so that it's sort of the same. Sequential, which in some typologies, such as John Creswell's and Vicky Plano-Clark's, is referred to as explanatory because qualitative phase is aimed at explaining or elaborating on the quantitative results. And the next one, the third core design, is sequential or exploratory because, again, you use a qualitative to explore the phenomenon of interest and then to inform the subsequent quantitative phase. This is what happens in concurrent or convergent mixed methods design, where quantitative and qualitative data are collected and analyzed independent, right? And their interpretation is based on combined or merged quantitative and qualitative results. To illustrate, I'm using the dissertation study that was actually done here in the School of Public Health in the Health Behavior Department by Yoko Kawamura, and it was chaired by Dr. Connie Cole, if you remember her. Yes? Yeah, so that was probably one of the first mixed methods dissertation studies done back in 2006. So we published that study. So the study aimed to understand or assess parasocial interaction in an entertainment education program, such as Body Love, on the program audience. And I specifically listed research questions, again, so that if you are doctoral students and you're thinking about designing or using mixed methods for your dissertation study, you can kind of have an example. So your quantitative question was, does exposure to Body Love program result in parasocial interaction? And what effect does parasocial interaction have on self-efficacy and practice of physical activity? The qualitative question, and these aim on arms or strands were conducted separately, was aimed at understanding of the role that parasocial interaction plays in self-efficacy and practice of physical activity. And then the mixed methods question that aims at the integration, right? We have to have this mixed methods question. So the question was about the theoretical model that can explain what happens with this parasocial interaction and its effect on physical activity, self-efficacy, when listeners are engaged with the entertainment education program. So this was the diagram of the procedures that were employed in the study. Again, in mixed methods research, we love diagrams because otherwise, how would you communicate, right? Complex quantitative and qualitative procedures that are occurring in the study, and where that integration point or point of interface, that's the term that we like to use, that's where the quantitative and qualitative methods or results come together, occur. So you see, for the quantitative, she used a survey that was applied regularly to the listeners of the program, and she used structural question modeling to test the variables based on that survey data. And then for the qualitative, she conducted interviews with the active and semi-active listeners of the program, and then used a grounded theory approach, a qualitative approach, to develop this kind of understanding of the process, what happens with the study when people listen to the program, and how that influences physical activity self-practice. And then she integrated the results from the SEM and grounded theory to create that composite model. And it was interesting that during her defense, one of the committee members was like, what? There's so much that came from the qualitative component to enhance our understanding, because she could only test certain number of variables in her SEM because of the limited sample size. So that's the model that she came up with, and of course I'm not going into details. You can read about the study. The references are provided at the end of the presentation, so you can see. And just to give you a clue, that's what comes out from the integration, right? That's how you can explain what happens, and in this case, what's the role of this parasocial interaction, or this kind of relationship that listeners develop with the characters of the program. This is what happens, and how that influences their physical activity self-practice. So another example is actually based on using secondary data, which is probably relevant for those of you who are in epidemiology, right? Because we, in epidemiology, and I myself graduated from epidemiology, a lot of research is based on that. So this is the great example of using mixed methods, completely based on secondary data. So this study aimed at understanding population-based health promotion, or develop a promotion population-based model for promoting older driver safety. And what they did here, they used the National Crash Data Set, Fatality Analysis Rating System, as you see, to actually analyze, the risk protective factors for drivers that are 65 years and older. And then they conducted a qualitative, they called it meta-synthesis, to actually see how stakeholders' perspectives can explain this unsafe driving. And what they did here, and that's kind of interesting, they identified, they did a literature review, and they located a number of qualitative studies where focus groups were conducted with caregivers, older drivers, social workers. And the sample size that was used in those studies was actually quite impressive. And they analyzed this kind of meta-analysis based on the findings that were reported to pull out those perspectives of the stakeholders. And then based on, as you see in mixed methods questions, they plan to create that model based on the results from the quantitative and qualitative analysis. This is a quite elaborate diagram, right, of what happened in the study. Again, I'm not going into details, but they listed everything what happened. And see, this is where the integration happened. So data comparison and integration, how they brought the two together. So moving forward, the sequential design, again, to remind you, sequential quantitative to qualitative begins with a quantitative component, right? And the results of the quantitative statistical analysis informs in the subsequent design of the qualitative component, and then the findings are interpreted together. To illustrate, this is a recent study that I mentored. Brooke Sharon, she graduated from the School of Nursing with a PhD degree, and then she conducted that study. It was a national study to examine decision needs and contextual factors that influence fertility status assessment in among young female survivors of childhood cancer. And her quantitative question, research question, aimed at identifying reproductive health values, behaviors, knowledge gaps of young adult females, female survivors of childhood cancers, as well as socio-demographic, developmental, and reproductive health factors that are related to receiving the this FSA. It's some kind of the treatment that is being used. The qualitative focused on identifying contextual factors that, again, influenced the survivors to consider using that treatment. And the mixed methods question was more aimed at identifying the components that should inform the intervention for that further test a specific issue. And this is the visual diagram. Again, it shows, and this is a very traditional format, it shows that how she started with the survey, and she targeted quite a large, it was a national sample based on 4 sites around the United States. And she quantitatively analyzed that data. Then, based on the analysis of the quantitative results, she selected the participants for further interviews to better understand the intentions to participate or not to participate in the treatment. And finally, another sequential design beginning with the qualitative, right, interviews of focus groups, to inform the instrument development or the location of the instrument, knowing the variables, the further test, etc. I like the study. I always use it because I so much like it, and I will tell you why. This is an example, of course, of the use of this design to develop behavioral measures of factors associated with microbicide acceptability, and it was based on, analysis, secondary analysis of the qualitative data. So, but what I like about it is the authors referred to it as an integrated mixed methods design. Why? Also calling it full circle approach, because this is what they did. So you see, they sort of closed the loop, right? So they started with the qualitative phase where they did analysis of the results from already conducted studies, and there were quite several studies already that were going on around this issue that they had access to as PIs, co-Is, and they just reanalyzed the data that, or the interview data that were available to pull out the items that or quotes that were relevant to inform the development of the survey. And then they went through the traditional route of psychometric analysis. They did conducted cognitive interviews. They did expert review of the potential items that they created based on this initial analysis of the reported qualitative transcripts. And when they finalized the quantitative survey, they conducted factor analysis, right, to come up with the factors that would inform the scales or actually test the reliability of those scales. And this is what they did here. See, they called it confirmatory qualitative analysis. They didn't stop here. Okay, yeah, we got the factor analysis. We got good loadings of the items on these 4 factors, which could be the scales for subscales for the survey. But they took those subscales, or what they developed, what emerged from the quantitative analysis, factor analysis, and compared with the themes and categories that they originally developed from the analysis of the qualitative data. So I think that was really quite strong in terms of developing a rigorous survey that was rooted in the views, qualitative views of the participants, right? So that's why I like it so much. So speaking about integration, what constitutes integration or mixing, which sometimes is also used in mixed methods research? Back in 2009, when Ted and Teshikori published their first edition of their Foundations of Mixed Methods Research book, they said recent conceptualizations of mixed methods research recognize that a study is truly mixed only if there is integration of approaches across the stages of the study. Just think about that. How many times you have read studies that reported quantitative and qualitative results, right? Was there integration? Sometimes there was, sometimes there was not, right? So many times, yeah, we read, and that's why there's all this debate. How old is mixed methods, right? Because people were collecting quantitative and qualitative data within one study. I don't know, since Aristotle, right? Aristotle is, by the way, considered to be the first mixed methods researcher because he used observation as well as numbers, right, in his scientific work. But, when studies report just quantitative and qualitative and no integration, we probably could not consider them as mixed methods, right? So that was the issue. Okay, so moving forward. So what is integration in mixed methods? It's an explicit interrelating of the quantitative and qualitative methods or data or results, whatever, in a mixed method study. We like to say interrelating quantitative and qualitative approaches with one study, which sort of kind of is more inclusive term. And of course, the more the two methods or approaches are integrated, the more integrated the mixed method study will be. That was observed back in 2006. I still like to use those quotes because, it shows the relevance. And 1 + 1 equals 3, right? Of course, mathematical is not correct. But that's what we try to achieve in mixed methods, because it is believed that the sum of quantitative and qualitative should be more, right, than the individual components. Just think about that, right? Okay. Yeah, I like this formula. So what are the goals of integration? Again, just to give you a few, the most kind of overarching ones. Of course, we are interested through integration to create meta-inferences or integrated study conclusions, which are grounded in the results from the entire study, which would give you better comprehension and better understanding of the research issue, more validated conclusions, etc., right? Produce more convergent or corroborating results about the issue that you study, because you're pulling evidence from different data sources. Eliminate or minimize potential alternative explanations of the findings. For instance, if you do either a quantitative or qualitative study, right, there are so many issues or questions that may be unanswered, right? But when you use both, you use mixed methods, then you have this opportunity to kind of, at least minimize, those the number of questions that may have not been answered within the study. Explain the divergent aspects of the phenomenon of interest when you are engaging participants through different methods and, based on their availability and ability to participate. And also increase the scope of research by using different methods for different study components. Like in that example that I gave you about, doing research in a hospital setting, doing survey for patients because it's more feasible and there are more patients than clinicians, but doing interviews with clinicians and maybe engaging nurses in a focus group, right? Because they're on site and it's easier to put them together. So this is a very interesting article that was published in the special issue on mixed methods research of the Journal of Health Services Research in 2013, and that's where it's very honorable group of researchers, Mike Fetters, Leslie Curry, and John Creswell, developed a table of the levels of integration mixed methods, which again kind of now serves as a foundation, or one of the foundations to speak about integration and mixed methods. So they showed integration at the design, that integration can occur or should occur at the design level when you use either these three core designs that I already introduced, or we call it intersect mixed methods or core mixed methods designs with established frameworks or designs such as case study, experimental research, CBPR, action research evaluation, social network analysis, just Delphi study, Delphi method, to just name a few. And then integration can occur at the level of method of, the method of integrational strategy that are used within those designs, which are sometimes design specific, which I will show in a moment. And also, and this is great because nobody could figure this out before this was published, how this actually happens, at the level of interpretation reporting. How do you report actually the integrated results in a publication or dissertation study, such as in the narrative weaving, when you use, a quantitative and then qualitative to explain, or vice versa, or you use data transformation when you change quantitative to qualitative, or vice versa, and also joint displays, which I will highlight today. So speaking about strategies in designs, in mixed methods designs, so remember this is the core mixed methods, concurrent mixed methods design, where quantitative and qualitative data are collected and analyzed independently. So here the strategy, most kind of adopted strategy is combining or comparing. Sometimes it's referred to as comparing, when you combine the two sets of results together and draw inferences. Or you can also do merging, when you transform one data set into another. And that happens for some reasons. For example, you have the data from the surveys and interviews, but the surveys, you had a very small sample size, right? And it's just not probably enough, right? Or maybe not that substantial to report quantitative findings. So you may transfer them into qualitative findings and then analyze the whole data set qualitatively, or vice versa, when you can assign, after the qualitative analysis of interviews or focus groups, you can assign frequencies based on the number of times specific codes or categories or subcategories I mentioned, and convert them into quantitative and use those numbers, so those frequencies, together with your numbers from the survey to analyze the data set collectively. It's a very interesting strategy. It's not that popular as other strategies, but it's used in mixed methods research more often than not. So this is an example of a joint display of application of this integration strategy in concurrent design. So a joint display is a table. It can be a table, a figure, but in most cases it's a table like that. There's no like a recipe what needs to go into it. So it's, of course, depends on what you what's the purpose of the study is and what you want to compare, but it serves several purposes. First, it helps you as an analytical tool to kind of see what you have from the quantitative and qualitative analysis of your data, right? To compare them. Then it serves as a tool to interpret, and of course a tool as to report, in a paper when you publish it, or in a dissertation study, to kind of show how your quantitative and qualitative results align. So this is a joint display or table from the study that we did here with Dr. Derek Dubai on African Americans' intentions to become a registered organ donor, and we collected the data from focus groups And our participants completed the surveys about their knowledge of organ donation and attitudes, as well as focus group discussions. And then we just were sitting there looking at the data. We couldn't figure out what to do with that. And in those times, 2006, when we published into 2014, so we didn't even know the word joint display. And then let's do that. Let's put this all together. And this is what we did. And this has kind of helped us. And this is just one example of course, it's a part of the table that we reported. For instance, we looked at what would be the advantages, right, of becoming a registered organ donor. And so we compared the percent of text references. That's how many times participants talked about that specific topic, and also the odds ratios in terms of the and you know that, right? The probability of becoming a registered organ donor. So, for example, saving someone's life, right, was mentioned among the advantages more often than other. And it was also supported by the p-value based on the odds, this logistic regression analysis. So this kind of showed us or helped us understand what was going on in the data when, that we collected from both data sources. Same with another category, making it your own decision, was both supported. And then for disadvantages, it was both fear and legal issues. But look at that, religious, this blue box, right? Religious and moral beliefs was not discussed much during the focus groups. And it was not supported, through the quantitative analysis. So that's probably was not an important issue for people why they don't become, or why they become a registered organ donor. And finally, this is probably most interesting, social justice issues. Sorry, my voice is now becoming to fail me. It was not discussed much. Maybe the questions were not framed correctly, we don't know. But this is an issue that was reported in the literature, such as one of the factors, right? And it kind of had that kind of borderline p-value, but still kind of significant, right? Quantitatively. So we addressed this in the future research. So that also helped us understand how to move forward with that. Look at this one for now, and I will just take my Luden pill, which helps me. Well, I will try to speak with it. So this table shows a cross-case comparison of the findings from medical records, surveys, and interviews with people about their self-care for heart failure. And the authors just illustrated 3 cases here in the published article, so that you can see how that was or can be done. And that's again a way for you to understand what you're getting from all that data that you collected quantitatively and qualitatively. This is an example of joint display that I like very much because it added the column of interpretation. And that's the study that was conducted by Dr. Janet Turan, you know her, right, from the Department of Health Organization and Policy, about patient and provider perspectives on HIV stigma in healthcare settings here in the southern United States. So what they did here, they reported themes that emerged qualitatively, right? They put in illustrative quotes. Then they reported the quantitative findings from the survey and other assessments. And they provided brief interpretations or explanations what actually that means. That's why I like it so much, because it helps you immediately see, okay, so HIV-related stigma and discrimination in healthcare settings. And this is how we need to understand this data about that. So this is very powerful. Highly suggested. And this is for someone who likes numbers, statistics, right? A very interesting way. We don't see this a lot, but this is a very interesting way to kind of show the relationship between, or interrelation between quantitative statistical results with qualitative quotes or findings that emerge qualitatively. So this study aimed at understanding clinical trialist perspectives on the ethics of adaptive clinical trials, and you see the colors match, right? So purple is stakeholders, other stakeholders. Yeah, I don't know how, well, you know how to interpret this, but that's what I like about it. Of course, you have to pay extra to publish something in color, right? But that's a very interesting way to show a joint display. So that was concurrent design, right? So just now to remind you, so this is a sequential, quantitative to qualitative. So what happens here, and this is interesting, you have sort of two major integration strategies. You first have to connect, right, from the quantitative to qualitative, so after you have analyzed the quantitative data. But you also connect here, right? This is another strategy, means combining. So it's connecting plus combining. So you create meta inferences based on the two sets of results. And for the illustration, I will show you that's based on my study. It's not from epidemiology, not from health sciences, but this is a study that I conducted with students who took my research methods courses that I taught online. And the purpose was to understand whether learning research methods online is effective. And at that time there was a lot of discussion about online teaching and how effective it can be, right? So what I did, I conducted a survey of all students who took one or more of my research methods courses, independent on the type of the course I taught, and then I didn't even know how to approach the qualitative component. So what I decided then to look, okay, so let's look at a typical case and what consistency in how they reported quantitatively or assessed the effectiveness, because effectiveness was measured using two methods, and also knowledge and application of research methods. So I kind of looked across consistent scores. And then I looked at the extreme case, but everything was kind of low, right? Both quantitatively and qualitatively. Across all the variables, sorry. And that was much more interesting. I call them unique cases because I saw discrepancy in terms of how differently, the results were, how different the results were across these four variables, right? And just to give you an idea, for example, Martha, who is the first one here, right? Martha, and of course, this is a pseudonym. So she rated effectiveness as 1, which is low, right? And 3.6. But the knowledge and application is high. What happened? So when I talked with her during the interview, it turned out that she actually liked everything about the online. She did not like the discussion component when students did not participate fully and no learning was happening in this discussion, interactive type of environment. Hey, I wouldn't know that, right, if I didn't speak with her. So that's why I'm just giving this as an example. That's how you can approach in this design the selection of the participants, right, for follow-up, based on what you see quantitatively, and again, depending on the research question that you want to answer. Another example of a joint display just comes from a recent dissertation study, actually recent publication. The study was done here in the School of Public Health by Dr. Jasmine Vickers. We just published that article. She conducted assessment of strain and related support needs of family caregivers of hospitalized patients with delirium. And she conducted interviews with patients, with caregivers, and also she conducted interviews after she first assessed them quantitatively, asked them to complete those measures, and to assess the stress level, also emotional, all the other kind of issues that are related to providing care for these patients. And also then she followed up based on the scores with those caregivers. Sample size was small, so she actually had to take everyone who agreed to participate, but this is how she reported based on the scores, on those measures. And she provided these quotes, right? Quotes related to stress and quotes related to support needs. Again, that helped explain those scores. In another study that was done by surgeon, Dr. Abhishek Parmar here, he assessed the results from about the stitch trial. It's a stitch trial or stitch method that they use in gastro hernia surgery. So it's kind of a method that is becoming kind of used nationwide, but it's still kind of like, they're assessing its usability, etc., among the surgeons. So he conducted a survey and qualitative follow-up interviews with the surgeons about their views on adoption practices of this method. And that's how he reported, like, the domain, based on the domains of that theoretical domains of adoption of practice framework, knowledge, survey item, and the related codes and supporting quotes. Again, another way of showing and as well as interpreting the results. And finally, integration strategies in sequential qualitative to quantitative, same as in another sequential design. You first have to complete and connect the qualitative connected to the quantitative phase of the study, right? Like through the instrument development or set of variables. Then use the two data sets to create meta inferences. And unfortunately, we don't have many examples of joint displays for this design, but this one is very prominent. This comes from the Morrow's and colleagues' study that I showed earlier about developing a measure of microbicide acceptability, remember? When they used this full integration circle. So this is how they showed how the items from the based on the qualitative analysis were grouped into quantitative scales.